Hi, my name is Karen Liberi, and I am a women's health clinical specialist. And I have realized over the years that a lot of my patients have had some anxiety about coming in for their first physical therapy visit because they're not really quite sure what that's going to entail. So I figured I would do this little video blog to walk you through it. So, with some physical therapists, they are cash-based practices, and with other physical therapists, you will need to go through your insurance, and so we would need to get your insurance information ahead of time, verify your insurance, just to make sure that everything's ready to go for the first day. Once we have all that in place, we usually send out an information packet for you to fill out ahead of time for us to get to know you a little bit ahead of time, which will help to lead us with our conversation with you when you come in. So once you come in, most women's health clinical specialists and women's health therapists usually will have a quieter office for you to feel free and comfortable to talk about what's going on with you. So I will take you on a tour of my office here. So let me put this around here. So here we go. This is a typical treatment room that we have here. And so typically we would sit and have a conversation for about a half hour or 45 minutes getting to know you. Meaning, what kind of childbirth history do you have? What kind of surgical histories have you had in the past? If you've been dealing with pelvic pain, talking a little bit just about your history leading up to that and what you've been experiencing. And allowing you to tell your story so that we really get a good understanding of what's happening with you. And after we have had a discussion with you for, like I said, half hour, 45 minutes, then we go into a lot of education mode. So if it's for pelvic pain, we do a lot of pain neuroscience education. If it's for incontinence, we do a lot of anatomy and physiology education on educating you why your body's doing what it's doing. And so most of us will have a pelvic floor model here that we can go through and explain the anatomy of what's going on with the pelvic floor and what's going on with the bladder. And sometimes what we'll do is something that's called biofeedback. And biofeedback gives us really good information about what your muscles are capable of doing. If they're really weak or if they're really tight, it helps to give us a little bit of an idea. So here we can take a look inside the pelvis, and we have our pelvic floor muscles going from our pubic bone in the front all the way to our tailbone in the back. And where you see like the little sticky pads, those are just on the outside of the rectal opening. And so we'll put those stickies on the outside of the rectal opening to get an idea of what your muscles can do. And then we would get you hooked up to biofeedback with those. And here's just an example. So I have my name up there as just an example of what we would do, where we would teach you how to activate your muscles and we could see what your muscles are capable of doing, have you try to hold those muscles to see how quickly they might fatigue, and then relax, looking at your ability to actually relax your muscles. And again, those with pain might have a really difficult time relaxing. Those who have pelvic floor muscle weakness might have a really difficult time activating. So we would just take a look at this, and it's just one more piece of the puzzle for us. After we complete the biofeedback assessment, then usually we'll do an intravaginal assessment to determine your ability to feel, like, what is your sensation in through the pelvic floor. I mean, generally I will press to the right side and ask, what side do you feel this on, just to get an idea of your perception of where you feel the pressure. And then look at the activation of your muscles to make sure that you're doing the Kegel in the correct way. And again, for those with pain, we're assessing scar tissue, we're assessing muscle tension, we're assessing myofascial tension, if there's any scar tissue from episiotomies or from hysterectomies, rectocele repairs, anything like that. And then educating you on what we found, and usually starting you with a basic home exercise program. So usually from start to finish, it's about an hour to an hour and a half for that very initial evaluation, where the majority of the time is talking and listening to your story and figuring out what we can do to help from there. So I hope this has calmed any fears about, what to expect when you go in for your very first pelvic floor physical therapy evaluation. Thank you.